Welcome to the Stroger Hospital and Cook County Health and Hospital System Training Module Number 13, Operating Room, Terminal Cleaning Procedure for Environmental Services. Thank you for your time and attention as we cover this important training subject matter.
Before we begin, let's talk about how we define terminal cleaning and what our goals are in performing this type of cleaning in the Stroger operating rooms. When we say terminal cleaning, we define that as the top to bottom disinfection cleaning of the OR once all surgical operations have been completed for the day. Terminal cleaning is distinguished from between procedure cleaning because it is much more thorough and because it is performed at the end of the day. The frequency of terminal cleaning should be once every 24 hours, and generally it is done after hours, during either the second or third shift. As an environmental services cleaning technician, your goal when performing terminal cleaning of the OR is to remove germs, bacteria, and microorganisms for the prevention of disease transmission from one patient to another.
A summary of the topics we will be covering in this training module will include the following. Number 1. The stainless steel cart used for cleaning the OR. 2. Preparing yourself and your equipment before entering the OR. 3. Pre-inspection of the OR. 4. Emptying waste receptacles. 5. Collecting soiled linens. 6. Cleaning the OR sink and surrounding areas. 7. Dusting and disinfecting high-reach areas. 8. Cleaning the operating room table. 9. Dust mopping the floor. 10. Damp mopping the floor. 11. Final inspection before exiting the OR. And 12. Removal and disposal of PPE and hand hygiene upon completion of your work in the OR. If you are ready, let's begin.
Notice that we do not use the same service cart for cleaning the OR as we do for cleaning the patient room at Stroger Hospital. For the OR, we use a service cart constructed almost entirely of stainless steel. Note that the bucket mop and wringer set are also stainless steel. Stainless steel provides the necessary higher level of sanitary infection control and minimizes microorganism cross-contamination. As such, it is vitally important that you always use a stainless steel cart designated for use in the OR. Never use a standard patient room service cart for your work in the operating rooms. Equally important is making sure that your cart is clean, sanitized, and spotless. Prepare your cart with the tools, supplies, and equipment you will need, and also make sure that you inspect your cart and that you clean it thoroughly before using it for your work. Finally, remember to include CaviWipes 1 and CaviCide 1 disinfectant cleaner on your cart. This is the powerful and fast-acting disinfectant required for use in Stroger Hospital's operating rooms.
Once your cart is prepared, it is now time to prepare yourself with hand hygiene and PPE for work in the OR. Make sure that you have the correct PPE clothing. This includes a Stroger Hospital Scrubs uniform freshly cleaned. You will also need to wear protective latex gloves. But before putting them on, you must perform a thorough hand washing. For complete instructions on the proper way to wash your hands, please review Stroger Hospital's training module number 3 entitled Hand Washing and Hand Hygiene.
Now, your cart is clean and prepared. Your hand hygiene is completed and your PPE in place. You are now ready to enter the OR. Leave your cart and all of your tools outside of the OR. Never bring your cart into the OR. As you perform your work, you are allowed to bring in only the tools and materials necessary for the performance of the particular task at hand. Never bring in several different sets of tools and materials for the performance of a series of cleaning tasks. When you finish the task, you go back into the hallway, return the tool and materials you have just used, then obtain the item or items you will need to perform your next task. Your first task, upon initially entering the OR, will be to conduct a pre-inspection of the room. For this task, you may wish to bring in a clipboard or checklist. While conducting your pre-inspection, be mindful of planning your work by looking for any and all areas within the OR that will need special cleaning attention. Examples might include blood or bodily fluid spills on the floor or other surfaces, fingerprints or smudges on high hand-touch areas, items requiring repair or maintenance reporting to the Stroger Building and Grounds Department. Also, as part of your pre-inspection, be mindful to look for unsafe conditions in the OR, especially with regard to sharps improperly disposed of or left out on tables, trays, and floors, or in waste receptacles. If you find any sharps, do not touch them. Instead, report the situation immediately so that this unsafe condition can be corrected.
After completing your pre-inspection, your next task should be to empty all of the waste receptacles in the OR. Remember that in your pre-inspection, you looked into the waste receptacles to see if any sharps were improperly placed inside. This initial inspection, however, only allowed you to observe what is lying on the very top of the waste within any receptacle. Buried below could be improperly disposed of sharps that you can't see. Because of this, you must follow all of the required procedures to safely remove waste from each OR receptacle. For a detailed description of safe trash removal, please review the Stroger Training Module Number 2 on safety and safe work practices, especially the section on safe trash handling. Finally, as part of gathering trash from the OR, remember that you will be handling 3 separate trash types that must all be kept separate. Regular trash, collected in clear trash liners, biomedical trash, collected in the specially marked red trash liners with the biohazard label. Sharps containers, collected in the wall-mounted, sealed boxes, specially designed for safe disposal of needles and other disposable sharps. Never mix these separate types of waste. Also, when handling a full bag of standard trash or biohazard trash, always hold the liner from the top of the bag. Never attempt to compress the trash. Never lift a full trash bag from the side or bottom. Hold the bag away from your body and do not let it bump against your leg or any other part of your body. This is to avoid a needle poke injury that can occur if a needle is buried deep inside of the bag. Finally, if you need to remove a full sharps container, remove the entire sharps box. Never attempt to open the sharps container. Never try to empty the sharps container by removing the contents within. Sharps containers are designed to be disposed of whole and replaced by a brand new, empty, and unused sharps box.
Your next task, after removal of trash, is to collect all of the soiled linens in the OR. You will find most soiled linens on or near the operating table. However, carefully look around the room in case any soiled linens have been left on trays, counters, or tablets, or have possibly fallen on the floor. Carefully examine the linens, looking inside the folds to be sure that no sharps have been accidentally left behind. Next, strip the linens from the operating table or bed and carefully place them in the blue bag container for the collection of soiled linens. Other linens that may be found elsewhere in the OR should also be placed in the blue bag container.
Now that you have collected all of the trash and all of the soiled linens, it is time for you to begin actual cleaning and disinfection work. Start this work at the OR hand scrubbing sink and the areas adjacent to the sink. As with all cleaning and disinfection work, start high and work your way down. In this manner, any dirt or dust dislodged or any splashes or drips that fall down will be cleaned as you work from top to bottom. Wipe all surfaces above the sink with a heavy coating of Cavicide 1 disinfectant cleaner and allow for the full 60-second wet dwell time for the solution to kill microorganisms. Clean the walls, mirrors, soap dispensers, and other surfaces above and around the sink area. Next, clean faucets, sink backsplash, and the large square bowl basin of the sink. Follow through by cleaning and disinfecting the front, side, and lower exterior surfaces of the sink, including any exposed plumbing pipes under the sink. All surfaces must be cleaned with the Cavicide 1 or CaviWipes 1 disinfectant, and all must be given the full 60-second wet dwell time for full disinfection.
After finishing your cleaning of the scrub sink area, perform hand hygiene, and then it is time for you to return to the main area of the OR and begin dusting and disinfection cleaning of high-reach areas within the room. Again, the protocol of cleaning from top to bottom must be carefully followed. First, dust and disinfect high-reach vertical surfaces such as walls. Use your extension tool, equipped with a flat microfiber cleaning pad to perform this work. Identify a section and clean systematically from top to bottom. Then move sideways to the next section and repeat. In this systematic manner, you will make sure that all surfaces are thoroughly cleaned. Clean and disinfect all high-level light fixtures and equipment, especially the frames and lenses of the large surgical lights positioned above the operating table. In most ORs, these lights can be pulled downward, allowing you to easily reach all surfaces of the lights and frames for thorough disinfection cleaning. Remember to allow the full 60-second wet dwell time for proper disinfection and microorganism kill.
Upon completion of cleaning the high-reach areas, it is time to clean the mid-level and low-level surfaces with an emphasis on cleaning high hand touch areas. As you perform this work, you must continue to keep in mind the practice of cleaning top to bottom and high to low. In planning your work, take a moment to look around the OR and identify in your mind the high hand touch areas. These are areas that receive a lot of hand traffic by the medical staff who work in the OR. They include doorknobs, light switch plates, surgical light adjustment handles and pull spots, tray tables, counters, cabinet pull knobs. This emphasis on cleaning high hand touch areas does not mean that you skimp on the cleaning of other areas around the OR. All surfaces must be cleaned and disinfected. Instead, focusing attention on the high hand touch areas helps to make sure that visible fingerprints, smudges, or smears of blood or bodily fluids are fully eliminated from these surfaces. As you clean and disinfect all equipment, such as stainless steel trays and stools, work from top to bottom, finishing up by cleaning the lower legs or pedestals of these items. Conclude by wiping all baseboards in the OR, making sure to leave them in a clean, bright, and streak-free condition.
Because most of the activity of the OR is conducted on the operating table, this piece of equipment must receive special and focused attention in your cleaning and disinfection work. All surfaces of the operating table must be disinfected using Cavicide 1 or CaviWipes 1. Also, the protocol of working from top to bottom must be strictly followed. Removal of all soiled linens from the operating table should have been fully completed in the earlier steps of your work in the OR. If any linens remain, remove them now. Cleaning of the surgical lights above the operating table should have been completed as part of your cleaning of high-reach areas. If the lights were not cleaned previously, start by cleaning and disinfecting them first. After all lights and other equipment above the operating table have been cleaned, it is time to clean the operating table pads and the upper stainless steel surfaces that support the pads. Clean both sides and all edges of the large flat pads. Clean the stainless steel tabletop that the pads rest on. Clean the table arm supports and restraining straps. Clean the side rails of the table. Upon completion of the pads and the upper stainless steel surfaces of the table, clean the lower level surfaces, including the table pedestal and base. As with all other cleaning in the OR, pay special attention to allowing a full 60-second wet dwell time for full microorganism kill on all surfaces of the operating table.
Once you have completed all tasks associated with cleaning and disinfecting the operating table, it is time for you to begin cleaning the floor of the OR. This task starts with dust mopping. Before dust mopping, if you find a spill of blood or bodily fluids on the floor, this must be cleaned up using Stroger Hospital's required safe work procedures for blood cleaning. Please be sure to review Stroger's training module number 24, entitled Bloodborne Pathogen Cleaning, for a detailed explanation of this important safety protocol. Use your dry, microfiber flat mop to perform dust mopping. Work your way through the OR in a clockwise progression using an S-stroke as you push the dust mop along. Do not sweep with the dust mop by lifting and pushing like you would do with a broom. Also, do not shake out the dust and debris clinging to the mop. This will release dust and contaminants into the air of the OR. Instead, keep the dust mop moving and always in contact with the floor, with the leading edge pushing forward and dust and debris gathering along in the front of the mop head. Be sure to dust mop in corners and along edges because this is where dust and debris can accumulate. Also, move light furniture and objects to dust mop underneath. If you encounter heavier or unmovable fixtures, reach under as far as you can to dust mop under these items.
Damp mopping follows after dust mopping. Use your flat microfiber mop head and pad and perform damp mopping in a similar manner to dust mopping. Specifically, work in a clockwise pattern through the OR and use an S-shaped stroke with your damp mop. Be sure to mop the corners and edges of the OR floor very well. Do not leave accumulated dirt or debris in corners or along edges. Move light furniture and objects. For heavier fixtures and objects, be sure to damp mop underneath as far as you can reach.
Upon completion of damp mopping, you are almost finished with your duties for terminal cleaning the OR. As part of wrapping up, make a final inspection of the entire room to make sure any last details have not been missed. As part of this final inspection, be sure to check the following. Make sure there are no visible signs of debris, dirt, fingerprints, spots, or spills that have been left uncleaned. Note any items that need repair and maintenance. If there are any, make a note to report this to the Building and Grounds Department of Stroger Hospital. Look around to make sure you haven't missed emptying any waste receptacles or left behind any soiled linens. Look also to make sure you have picked up all of your tools, equipment, and supplies, and that you are not leaving anything behind.
Upon exiting the OR, remove and properly dispose of your PPE, including your protective gloves. Wash your hands thoroughly in accordance with Stroger Hospital's training module number 3, hand washing and hand hygiene. If you are unfamiliar with this module on hand washing, make arrangements with your supervisor to review the module before doing any work in the OR.
Thank you for participating in Stroger Hospital Training Module number 13, Terminal Cleaning of the Operating Room. We hope that you have found this training session useful and informative. As always, if you have any questions on this module or any other of your duties as a responsibility of your EVS technical cleaning, please inquire with your supervisor.